Hi, I'm Dr. Vinod Methil, consultant diabetologist at Sweet Clinics, Vashi. We are in a very bad second wave of COVID-19 pandemic, and in this video I'll be telling you about some important steps to be taken if you have any symptoms of COVID-19 or if you become COVID-19 positive. The first most important step for a patient with type 2 diabetes who gets any symptoms of COVID-19 like cough, cold, fever, sore throat, the first most important step is to get themselves tested. Do not delay your testing. As I've told in my early videos, any diabetic patients who become COVID-19 positive, their risk of serious illness is very high, and therefore if they start treatment early, then the risk automatically comes down. So it's first step, very important, is to get yourself tested. Now if you come positive and if you have symptoms, the second important thing which you should be doing is to contact your healthcare provider. Get his instructions and follow his instructions as has been told by him. Take all the medicines as has been prescribed by your healthcare provider. Important, do not self-medicate. So follow his instructions. Third important thing which needs to be followed is to control your blood sugars, keep your blood sugars well under control. As I've said before, diabetic patients whose blood sugars are under control, their risk of getting any form of severe illness is lesser, is similar to that of the general populations. But if the blood sugars are not controlled, if the blood sugars are high, then the risk of any severe illness also increases. So you need to keep your blood sugars under control. Do not stop your diabetic medicines. Do not stop any other medicines which you have been taking. Follow your health care professionals' advice. There will be some medications given by your healthcare provider like steroids which can increase your blood sugars. So monitoring your blood sugars regularly with a glucometer at home is also very important. Whatever the readings, inform to your doctor and then get your blood sugars corrected. The next important thing for you to do is regularly monitor your temperature, your oxygen saturation, and look into your breathing efforts and inform this to your doctor at least once or twice in a day. And if you find any of this is going beyond control, if your saturations are going down, please contact your doctor. So if you are continuously running temperature for 2 to 3 days, if your saturation starts going below 95, 94, if your saturations fall after the 6-minute walk test, consider getting yourself admitted to a hospital so that further care can be taken of you in a good setting. So if you are diagnosed with COVID-19 and if all your vitals are stable, first is don't panic, don't rush to a hospital. You should be in touch with your healthcare provider. You should be monitoring all your oxygen and temperature. If they are being maintained, you don't need to go to hospital. You just continue with whatever your doctor has advised you with the medications. But if your oxygen saturation starts falling, if your fever is not subsiding, it is at this point that you should consider to go to hospital for admission. So to conclude, I would say don't panic if you are COVID positive. Most of the patients, even most of the diabetic patients, come out safe and well. Just take all the precautions necessary, take care of yourself and be safe. Thank you.